A portion of today's show is sponsored by Dr. Naila Malik.
You know, we always hear that it's what's on the inside that counts, and it's true, but the way we feel about our skin can also affect us in many ways, and that is especially true when it comes to adult acne. And Dr. Naila Malik is here to share some skincare tips that can help you deal with this. And, you know, it's surprising the number of adults, especially women, who deal with it. What Dawn and I were just saying, we both had bouts.
Well, so do I. And in fact, the numbers are over 50% of women have acne after the age of 20. I know.
Really?
And I'm one of those, and I hate that. And over 40% of guys have breakouts or acne after the age of 20.
Interesting. Is it hormonal?
It is hormonal, obviously. A lot of women experience acne, or men, around puberty, of course, from hormonal fluctuations. But then around menopause, or right before that time, you get a second surge of estrogen testosterone imbalance, and that can lead to adult acne as well.
Just like when I was a teenager, it pops up during certain times of the month. So.
And you know, everybody has their own triggers. It could be certain types of food. For a lot of people, it's the stress. Correct. Stress, either physical stress, emotional stress, you know, any of those sort of things can bring about breakouts. So for me, what I noticed was that when I was using over-the-counter acne products, they just didn't do quite well. I mean, they seemed to work for a little while, and then I would be back to where I started. So what happens is that a lot of over-the-counter products, they have over-drying agents, so they tend to over-dry your skin. So you may experience a little bit of improvement in the beginning, but then that over-drying of your skin leads to more inflammation. And remember, acne is an inflammatory process, so you get into this acne, inflammation, acne cycle.
But you have a line now that treats it. And let me tell you, if it is anything like your anti-aging line, which I'm obsessed with, then I know this works.
Well, it does. We actually did a study on our patients who tried all the other products, and we put them on our acne products, and over 90% of people had significant improvement within 2 weeks.
Well, let's see some pictures. You have some for us, right?
Absolutely. Yeah, she's in her late 20s, and she had a very long time of acne, and we tried a lot of other products on her.
And it looks like it's like cystic acne, you know, and that's, as I get older, if I do get a breakout, it tends to be
those
more
under the skin, they hurt.
Yes.
Yeah. Well, she looks great. Look at the after picture.
That was only in 2 weeks.
What?
Yes. And
wow.
But, you know, and this is just with the products. Some of our patients do need other treatments, and we can add those to your skincare regimen, but skincare is the first line of treatment. So when you have adult acne, of course.
Wow.
And then,
there's another
He's in his early 20s.
That's amazing.
Now, this patient, we had to put him on antibiotics for a short period of time as well. But again, he had been on antibiotics before. A lot of people have been on all kinds of medications.
I mean, I have. I can list them, the ones I've had.
Yes, a lot of people who come to see me, they've been on so many medications. So it's about fine-tuning their lifestyle, putting on a better skincare regimen, and perhaps adding some in-office treatments. We do medical microdermabrasion, retin-A peels. Sometimes photofacial even helps acne, especially one that's associated with rosacea and stuff like that.
And so can that help? Because I always get, it doesn't matter if I don't touch a pimple, I will always get the dark spot afterwards.
Well, much more common in people with darker skin type.
Sure.
And of course, I get those as well. It's called post-inflammatory pigmentation, or PIP. So if you reduce inflammation that's associated with acne, that reduces post-inflammatory pigmentation because inflammation is less. But I'm very, very conscious of those dark spots that I get. So I do have ingredients in my acne products that help reduce the dark pigmentation following acne.
What was that process like, working with the labs and creating what you knew would be a really different product?
It was challenging, of course, because I obviously took the medications that have been around for 20-some years, so nothing new in the way of medications, because I know that they have proven clinical efficacy. So I used the same medications and then added a lot of anti-inflammatories to reduce the inflammatory component of acne. So the products were based on medications that have already been studied and they're clinically proven to work. And then you just take out some of the ingredients like parabens and artificial color and artificial fragrance.
Some of the things that dry the skin out.
Correct. And take out alcohol. You know, things that are very commonly found in a lot of acne products that are not really good for your skin.
I've got to get some of that.
Seems like you figured out the formula. Yeah.
I'll send you
Very
some.
good. Well, thank you. You can get more details on Dr. Naila Malik's skincare products by visiting NailaMalikMDSkin.com. And I promise you, if acne is not your problem and you want anti-aging, I'm serious. The products are fantastic.
She's the bomb.
Yes, and here's the great news. You can get 30% off on all of Dr. Malik's skincare products by going to her website and using the promo code BC30. B as in boy, C30. This is good through the end of November. And again, promo code is BC30.
I'm gonna get some of this.
Yeah.
I'm totally gonna get some of this.
Yeah, I'll
yeah.
send you some.
Great.
Hey. Okay, we are back with more right after this.